Good afternoon, everyone. Gareth Presch, founder of the World Health Innovation Summit. Delighted to welcome you to the launch of One Health, a book by my good friend Piero Formica. And I'm actually going to just hand it over to Piero to do a short introduction and introduce our esteemed guests. Piero, over to you, who's in Dublin.
Thank you very much, Gareth, for convening this meeting, and say thank you very much to my colleagues, Gareth, of course, Alan Barrell, Leif Edvinsson, Fabio Maria Montagnino, Peter Robbins, Oliver Schwab, and Nuno Almeida. All together, we have taken a journey long and full of adventures and knowledge to take up the words of Constantinos Favis in his poem Ithaca. This has been a journey heading towards what I call a grand transformation. Indeed, the One Health is an attempt to construct the future, leverage on the creativity of our mind, the human intelligence, that recognize how intrinsically linked are the economy, the health of humans, all other living species on Earth, and even the natural objects, such as rivers, lakes, seas, and mountains. As you know, in some countries or regions, even the natural objects today, they have the human rights. The COVID pandemic has shown that an effective health solution doesn't simply rely on technology. It requires changes in human relation behavior. The looming challenges we are faced with entails new thinking, a new approach to education. This is a critical point. Education should enhance the resource of imagination, intuition, and collaboration, rather than the passive memorizations and the competitive outcomes. Besides the reimagination of education, we need also to rely on transformative enterprises. These companies are holistic, heuristic. Heuristic means in this case, they prefer bottom-up learning. Each member discovers things from themselves and learns with the peers from experience gained from experiments. And the transformative enterprises are moral. High standards of fairness and honesty shape the behavior of this type of companies. Ultimately, and this is my third point, I said the grand transformation is about the health, the common good health, is about the reimagination of education for the good health, and the scientific enterprises. One Health shed the light on made in science. Normally we say made in Italy, made in Germany, UK, or in Ireland. To me, today, we need to use made in science. The strength of made in science lies in discovering new things hidden beneath the standard knowledge maps. Scientific production is the midwife of scientific enterprises. I have investigated this company in an essay called the Sciencepreneurship to be published before the end of this month. Made in science is invaluable, is inclusive, rather than the made in which slides toward the made luxury. Made in science means, take the case of the price of a, vaccine. If the price is so high, it's impossible for the majority of the people to buy it. And this aggravates the ongoing epidemic and the greenhouse effect. It will also jeopardize the well-being of those with such a well-having state. So the made in science is inclusive, whereas the made in is in most cases exclusive. Deeply embedded in all this concept is the idea of a health approach, which I repeat is holistic. So these are the main points of this treaty, or this essay, for which I again thank you, my colleagues. So giving the floor to my fellow co-authors, let me conclude expressing my gratitude to my institute, the Innovation Value Institute, which supports with the conviction and creativity the transformations needed to achieve the ambitious One Health goal. With his unwavering support of my institute, this book saw the light of the day. Again, thank you very much, Gareth. Thank you to my colleagues, and I leave it to you the floor.
Thanks, Piero. Let's go around the room just so that we can do short introductions to everyone who's joined us. Let's start with Dr. Meena Brewster, who's all the way in the States. Meena, delighted to welcome you.
Thank you. Thank you for having me. I'm excited to be part of this panel.
Fabio, who's in Cyprus.
Yes, I'm in Cyprus. I'm the head of innovation at the Cyprus Institute. So I'm very happy to be here and contribute. And I enjoyed to collaborate to this book. It was a fantastic journey.
And Alan, who's in London.
No. I'm in Cambridge, where I live. Where I've been here for 50 years when I haven't been traveling the world. And I'm so delighted to be here with my dear friend Piero and all of you. And yes, I'm privileged to have contributed a chapter to this book, which we'll talk about in a minute.
And let's bring in Martin, my fellow countryman, who I think is on the west coast of Ireland. Martin, delighted to welcome you here. And actually, the floor is yours, and we'd be delighted to hear your thoughts on the future.
Great, fantastic. So hello, I'm Martin Curley. I'm from professor at Maynooth University, and I'm so thrilled to have the honor of participating at the launch of this fabulous book. And I'm coming to you from Galway. So I don't know, Gareth, if you want me to just sort of share my thoughts on One Health at this point, or do you want to go to somebody else? I'm happy to move forward if you like.
Please do, Martin. It'd be great to have your thoughts, and then we can go to, fantastic.
Great. So I am just going a few slides here. Just bear with me, a short second. Actually, I think I need to upload these slides. Okay. Gareth, so maybe somebody else might go first, and I'll just upload these slides and then follow.
No problem, Martin. Let me start off. So I think what I'll do is I'll set the context for everyone and One Health and the transformative enterprise. I've been delighted to contribute to the book with the World Health Innovation Summit, which is pretty much a platform for sustainable development, which focuses on good health and well-being, SDG 3. And what I wanted to try and frame for everyone is the situation that we currently face and the model of care that we deploy in the health sector at the moment, which is on the left-hand side here, which is disease management. And on the right-hand side is the area of focus and growth, where we move into prevention at scale. And it brings big opportunity in terms of strengthening the health system, improving people's health and well-being, creating new and meaningful jobs, and also, bringing the economy forward out of COVID as well. How do we do this? This is the question everyone asks. How can we actually make this positive change? Do we have the evidence? Well, the answer is we do. We've proven it with the World Health Innovation Summit, and we're working with colleagues all over the world to implement this change. It's important to understand how do we actually deliver this. And the photograph that you see on the page there is our WHIS Nottingham event. And I want everyone to take a look at that photograph, because that's your GP practice at scale. That's how we influence population health across the community and build trust as well. And this is all about being able to share knowledge and support people to navigate their health and well-being, which is quite complex for people. But we have that opportunity. And then how do we create value? So I want people to understand the economics behind this as well. And we've seen through COVID how the economy has been damaged, because if you're not fitting well, you can't go to work. And you'll notice here, the people are what drive the economy. And as Piero mentioned and other colleagues have mentioned, we need these new social enterprises, these new models, these new businesses that are focused on generating value and building an economic model that's fair and leaves no one behind. And what we are actually presenting here is a new way, a new platform, how you create, children's programs, WHIS Kids, which supports children's health and well-being in the schools, WHIS at Work, which is stress management in the workplace, seniors that looks at falls prevention, loneliness, quality of life. So we give people the tools to manage their own health and well-being from early age right through to elderly care. So that's the kind of program, and it's a massive opportunity. We also then, what sprung out of the World Health Innovation Summit as part of the innovation, we've collaborated with our colleagues around the world. We've established now the Global Social Prescribing Alliance, which gives us this approach where we use WHIS as a catalyst within the city. And then we deploy the Global Social Prescribing Alliance and social prescribing with our colleagues and clinical colleagues around the world. So we anchor that into the institutions that are providing public health around the world. We actually, held an event yesterday, a very successful event, which was around Social Prescribing Day here in London. And you'll see James Sanderson from NHS England met with the Minister of Loneliness and Isolation from Japan recently to discuss the opportunities in Japan. And our plan is to take this global, and we've produced a number of frameworks, sort of booklets that can support that growth. This is just giving you an understanding of the opportunities working with the faith groups, Pope Francis. So I've been fortunate to be a member of his Vatican Commission on COVID-19 and working across the spectrum, whether it be with the European Commission and other agencies, so that we can build that collective. We have to measure the impact. We have to improve. It's not just change for the sake of change. What we did when we prototyped this, it was £1 invested, 36 back. And we improved, for example, the professional network of doctors and so on. So we have a model that's actually evidence-based. And then why do we need to do this? Well, it's quite clearly, the health service is under immense pressure. We're 18 million staff short by 2030, rising costs, population is growing. And this was all pre-pandemic. We are also facing the huge challenge of climate change. And this has to be the next focus of health and well-being as well, because it's the biggest health threat facing humanity. We lose about 13 million people a year just due to climate. The cost of air pollution, for example, is about $8 billion a day. So we need to shift the model to prevention at scale. And hopefully I've set the scene for Martin to come in and to give us his thoughts on how we move that forward. Martin, have your slides come back in, or do you want me to continue?
My slides are there, so let me just see if I can share them. Hopefully you can hear me okay. So again, look, it's a huge honor, and I actually think this is a fabulous book. It's so enriching. So I want to talk about One Health, and it's linked to Stay Left, Shift Left, 10X. Love the cover of this book. As you all know, One Health is a really important emerging concept that the health of humans, the health of animals, and the health of the environment are intrinsically connected, and that we need to collaborate across multiple disciplines to actually enhance the health of everybody. And when I look at the the authors that have contributed to this book. There are some giants there. I'm so looking forward to hearing from Alan. I think the chapter from Peter Robbins is fantastic, and I'll refer to that. But I just want to mention Stay Left, Shift Left 10X, and this is an initiative that we've been driving, Gareth and others will know, linked to how might we most effectively and efficiently accomplish the Sustainable Development Goal number 3, good health and well-being. And I'll come back to this, but what we're trying to do is make the healthcare transition globally through digital as simple as possible. And I'll explain shortly what Stay Left, Shift Left 10X means. But in the book, Professor Piero Formica, he starts by talking about the great transformation, the time in which we live. And he defines this new term, transformers. I think this is going to be crucially important moving forward because, like politicians, I think it was the ex-Prime Minister of Luxembourg who said, politicians know what they need to do, they just don't know how to get elected afterwards. I think we know what we need to do, but we're actually going to need these transformers to actually inject the energy to drive the transformation. So Professor Formica, he talks about, what are the triggers and the energies that are going to enable this grand transformation. And they are artificial intelligence, their data science, the Internet of Things, their blockchain. And we're at a very unique point in time where in the past, just one disruptive technology like the internal combustion engine or the railways came along, but now we have multiple disruptive engine or technologies all at the same time, and this is creating a perfect storm. And Piero calls these not reformists because reform isn't enough. We need revolution, and particularly in healthcare, we have a perfect storm of problems in terms of increasing demand. We have a demographic time bomb. We have a nutrition problem. And today, 50% of the world doesn't have access to affordable health care. And the 50% that do have access to care, it's becoming unaffordable. Now, the important word that Piero defines is a transformer. And he uses this analogy with the electrical transformer. So these are people that move energy towards utilization. Andy Grove, former CEO of Intel and founder, said, innovation is easy to talk about. It's a lot harder to do. And we need these transformers to actually drive this innovation and this transformation. And I think this important statement that Piero makes in chapter 1, he says, the transformers reject the standards of today's society, believing that the imposed social norms and cultivated expectations are becoming obsolete. We need to create a whole new paradigm for health, and particularly for One Health. And I've been arguing there are 3 Copernican shifts that need to happen, and these are so linked to One Health. The first is that we shift our healthcare system from being about illness to being about preserving wellness. The second shift is moving from doctor knows best to patient knows best. We need to move from edicts to patients to patient education. The educated patient is the patient that will excel. And then lastly, we need to move from hospital to home. A critically important, piece of work that has emerged, Campbell and others have led this, or McGuinness, that healthcare spending is only responsible for 10% of our health outcomes, but behavioral stuff like nutrition and exercise contribute 40%. Whole genome our genomics and genetics are 30%. The environment is critically important as well. But as you'll see shortly, we're spending most of our money on health, and we should be spending it in other areas. So a critical area in terms of thinking of One Health, and this is related to animal health as well as human health. Fabulous book produced by Colin Campbell based on the China study, and this argues for health benefits of a whole food, plant-based diet. And The book looks at the link between the consumption of animal products and chronic disease. And, the WHO has classified processed meats as a class 1 carcinogen. And, red meat itself is classified as a carcinogen. And yet consumption, rather than actually going down, is actually going up. And obviously the production of beef, we know, is a massive contributor to greenhouse gases. A key conclusion of this book is that people who eat a predominantly whole food vegan diet, and of course, avoid animal products, will escape, reduce, or reverse the development of numerous diseases. And chronic disease results in about 70% of our deaths. Unmanaged or undetected chronic disease, 70% of us will currently die from one of those. And in the US, 90% of all healthcare costs comes from chronic disease. So here is, I think, a fantastic recipe for achieving One Health, switching towards whole food, plant-based diets. And this is very good also for the animal kingdom. Just in the EU alone, we're spending 97% of our spending on illness and just 3% on prevention. So just small shifts in wellness spending can have dramatic impacts. Can you imagine being a venture capitalist and spending 97% of your funding in the lowest performing area? Now, of course, we need to fix people, and people that have accidents, we need to help them. But small shifts towards prevention, particularly using some of the work that's in the China study, will be hugely important. Another key development in the Copernicus shift is moving from hospital to home. And we have now technologies that can give better vital signs monitoring in the home than in the hospital. And one example is the WHIS technology from WHIS, a Scottish-based company. And this dramatically cuts down, for example, on travel. So it's reducing greenhouse gases, but allows patients to be treated in the comfort of their home. And to give a very good example, Dr. Mike O'Malley, and I'm in Galway today, he's a cystic fibrosis consultant. All of his patients with cystic fibrosis are monitored from home. They're saving about 900 euros each in not having to travel for the hospital for regular appointments. So 4 out of 5 journeys are avoided, particularly for these patients that are very vulnerable. They avoid having to be exposed to hospital-acquired infections. They're saving 3 days of travel time. But the greenhouse gas impact is really, really important here. If they're avoiding 4% or 4 of their 5 journeys, that's a really good thing for the environment. And just to mention the return on investment here, and Piero and Gareth talked about this briefly, the return on investment, this solution makes really good economic sense. The return on investment is greater than 8,000%. So Piero talks about transformers. So these are the people that actually, take these energies and action them. And Piero says, transformers create the artifacts for the emergence of scientific endeavors that, unlike those born in the successive industrial revolutions, do not merely expand man's physical powers, and that's important, but magnify the powers of the mind. And I had the privilege of authoring Knowledge-Driven Entrepreneurship with Professor Formica and Professor Thomas Anderson. And what we're talking about is knowledge-driven entrepreneurship. And at the center of this One Health movement will be knowledge-driven entrepreneurship. Mary Carabal, who's an entrepreneur I work with in New York, she's the CEO of BIOS. She talks about our records, our rights, our revolution. I think there's a smell of gunpowder in the air because, as Piero says, we actually need revolution. Incremental innovation is not going to be enough. We have to be radical. And to do that, we need a couple of things. The first is shared vocabulary, and the second is shared values. So Piero in the book talks about successful transformation requires a shared vocabulary. so that it's easy for ideas to communicate with each other. And I think this is one of the most important contributions of the book One Health, is to introduce a shared vocabulary. And related to that is the idea of shared values. And again, I had the privilege of working with Piero and editing a book exploring the culture of open innovation. But the key theme of this book is moving towards an altruistic economy. And this is where people are, working towards a shared vision with shared values. That shared vision is One Health, where human health, animal health, and environment health can coexist in unison. I want to finish now. Peter Robbins talks about COVID tearing up the rule book for innovation. And he says in the book that COVID shifted consumer preferences, upset supply chains, prompted a radical think of clinical trial protocols, accelerated the adoption of digital tools, and catalyzed an explosion of investment in home and digital care. We're now at a crucial point where we have a choice as a society. We continue with that momentum, or what I fear and what I observe in healthcare, and particularly in Ireland, is a reversal to the inertia and the stasis that existed in healthcare. Eric Topol has talked about healthcare being and medicine being the most resistant discipline to change. And I am concerned that we're reverting to type. And that's why we need these transformers to step up and drive towards this shared vision of One Health. A last comment, and One Health is about healthy people, healthy animals, and healthy environment working together. And I believe technology and exponential digital technologies are going to be the key to catalyze and be the glue that makes this happen. Sharon Eldeem from the Galapagos Trust, she said, if there's one thing that COVID-19 has laid bare, it is that we cannot separate human health from the health of all other life on Earth. We don't have time, and it's probably quite a dangerous topic to talk about the origin of COVID, whether that was zoonotic or whether it was man-made. But it's very clear, whatever the origins of COVID, animal health, environmental health, and human health are intrinsically linked. So I am grateful, Gareth, for the opportunity to contribute to this launch. I think this is an absolutely marvelous book. As I read it, it's really enriching. There's some really thought-provoking ideas, and I just want to congratulate Piero and all of the authors on a really important contribution. I think the key idea is identifying and supporting the transformers that will make One Health a reality. Thank you.
Thanks, Martin. Fantastic to hear your thoughts and brilliant insights into the transformers. And I couldn't agree more. We really do need to support the transformers. And I think there is a huge resistance to change. Let me hand over to Fabio for his thoughts, and really looking forward to his insights into One Health and the book.
Well, I will share some ideas which brought me to write this chapter. When Piero proposed me to contribute, I said, we were immersed in this COVID nightmare, and the clear idea was that COVID was not isolated. COVID was the result of what Timothy Morton the philosopher is calling hyper-objects. So either it's because we are challenging nature and we are reducing the natural spaces and the viruses are getting out, or because we are forcing transformation of nature through manipulation in labs for other reasons. But in any case, it was the result of this interaction which is going bad between humans and nature. So I said this is the real opportunity to start thinking about the way we should redefine innovation in order to regenerate this dialogue with nature in, a sustainable way. And this is the reason why I suggested this chapter about the reorientation of innovation in the direction of sustainability. Because we talk a lot about sustainability, we build a lot of dialogues, organizations, forums, fora and discussions, but the reason why innovate is substantially the same as in the past. We are just accelerating the consumeristic process. So we are increasing pressure instead and using innovation in order to increase our pressure on natural systems instead of identifying the right, let's say, leverage points where we should activate innovation in order to rebuild this dialogue with nature, or if you want, to bring humans back to their connection with all the other players and actors and agents in the planet. So we are in the what has been named Anthropocene. So we are in an era where humankind is the most powerful agent in the world. We are transforming the world every day, and the world is changing, around us. What I say now, the challenge are ourselves. I mean, we are the challenge. We are creating this world. We are transforming this every day, and that's why we have to rethink the way we innovate, because innovation is the most powerful tool for transformation. So I have been promoting startups and new ideas from academic labs and research for all my life. It's 30 years I'm doing this job. And I'm really questioning why I'm doing this, which is the reason why every day we have to generate innovation and bring them into the society and into the market. So I connected the great transformation Piero is proposing to the great acceleration. So my point is how we can transform in order to slow down the great acceleration and bring things to a new equilibrium, and how transformative enterprise can serve to this. And that means that we have to rethink everything about the innovation pipeline, because the first question we have when we innovate is not what we are going to do, but why we are going to do that. If we accelerate in AI, or we promote the invention of new molecules, we have already in the world 70,000 molecules, and we know the impact on the environment of 500 of them. So most of the molecules we injected in the environment are unknown agents, and probably this is one of the threats we have against the planetary boundaries. So at the pace we are producing new molecules from our labs, probably in a few years we will be in a world which is different from the world of today, and substantially again out of our control. We have long-lasting pollutants all around, and we don't know, how they will affect the planet and ourselves. So then we play on the side of innovating for health, but on the mainstream, we are generating the molecules which are creating the problems we are going to fix with our innovation in the health environment, in the health ecosystem. So why don't we shift our attention and start thinking about what we are doing in the main innovation streams, and how this can be played in a different way? This needs, and I go into the key point of my conversation with Piero in these years we have been spending together, it's about education. I think that we have to start from the primary school teaching system thinking. We need system thinking. We need that people are understanding that whatever they play somewhere will create and generate issues somewhere else. And if we don't understand that quantity is creating quality, this is, what I learned from Georg Wilhelm Friedrich Hegel, that when you increase quantities, so the great acceleration is part of this, let's say, is showing the process, Then finally, you will modify quality of the systems. So on one side, we know that things are all connected. On the other side, we know that if we start stressing a system and the quantity is prevailing, the quality of the system will change. So we have to teach from the primary school. Kids should understand that we have to target quality instead of quantity. And targeting quality means that whenever you start generating quantity, you have to slow down and understand what you are doing. And that everything is a system, is part of a system. So we cannot touch the side, for example, of energy infrastructures without generating political dependencies. We cannot transform political dependencies without addressing the flow of materials around. And then we have to rethink our industrial chains because we want to break dependencies. We are learning now because of the pace of transformation in the world. Again, after COVID, we have now the shock of the Ukrainian war. And again, we understand that everything is part of a web. And whenever we touch one component of the web, we are creating issues on the other side. How transformative enterprises can play their role in this, let's say, system, and it's not new thinking. I mean, the Meadow report is of 1972, where this system is already described, the famous report to the Club of Rome of 1969 and then 1972. So it's 50 years we might think in systems, and we are not doing this at all. How we can create and which kind of companies we should support to play a positive role in these dynamics. We need they've been named zebra companies. So not unicorns. We don't need to scale up companies that are just generating results for the investors. We need a balanced model where companies are built from the very beginning to make positive impact in terms of sustainable development. And as I believe in the exponential capacity of transformative enterprises, because we have to play against exponential phenomena with exponential tools, transformative enterprise have an exponential capacity. But if we make them wrong, and the wrong ones, we overlap problems to problems. So I think it's a responsibility of innovation professionals and players to review their theory. We need a different theory. What I saw, for example, from Gareth's presentation is that what he's doing is the right thing. It's a transformative enterprise built and framed into a value proposition and an ethic proposition. We need to pervasive. I mean, we have to do this everywhere, from the AI to the health, to the biotechnology, to the chemistry and transportation and electricity and energy. So this is the main message I try to frame in this contribution to the book, and I hope that this will help in my world, which is the world of people helping people to other people to innovate, to start thinking from the very beginning about what they are doing. We have to be much, much more aware. It's a matter of awareness and consciousness about our role in the society.
Thanks very much, Fabio. Alan, we'd really welcome your thoughts.
Yeah, thank you so much. I will not repeat wonderful things I've already heard because I agree with everything that's been said. But I just want to remind you, I'm a practitioner and not an academic, although Piero kindly once called me a pracademic because he feels I'm becoming more academic as I get older, and I'm getting older all the time.
You are a polymath.
I was delighted to present this chapter to the book, and the chapter that Piero asked me to deal with was digital healthcare, and I'm not going to talk very much about the detail of technology here, because my reflections on all of this and what I've heard already is that what we are really seeking to do is to influence human behavior. I was a practitioner at the front line of medicine, then in the healthcare industry, and most of my life has been spent trying to help people implement. And strategy and policy is amazingly wonderful stuff, but making things happen is much more difficult. And, you know, we've talked about, and of course we would talk about, the COVID problem. And, you know, it was terrible and horrible, but something came out of it that was miraculous in my view. And I've written about this in the chapter in my book. Because what I saw happening in that period, when in months we produced a new vaccine, which would never have been thought about, it had taken years and years and years. What was it that made it happen in the way that it happened? It wasn't just the technology, it wasn't the science. It was all about the way people related to each other. And my message, which is a different message, but it's, I'm sure, one that you would attach to, is that relational thinking and relational behavior are extraordinarily important. When you think of what happened across functions, across disciplines, across borders, people communicated with each other in ways that they had never done before to make something good happen from a disastrous situation. It took a disaster. It took a terrible thing to cause human behavior to move in those directions. And I agree with everything I've heard about the need for educational change, because we have to get people to think much more about each other and what human behavior needs to do in order to be influenced. And, you know, I've sat in Cambridge on and off when I wasn't traveling the world for 50 years. And when I came here, there was a university and there were farmers, and there wasn't much interaction. There wasn't much real relational behavior. But now we have created 23 companies here that are valued at more than 1 billion. And, you know, it isn't just the science and the technology that's done it here. It's the way people think of each other and the way they work together. It's about connectedness, connectivity. I use the word connectricity, connectedness with energy. I've seen it happen here. And I'm sitting 5 minutes from the teaching hospital in Cambridge, where I work with the guys in the intensive care unit. And, you know, they did something fantastic through the COVID period and after it. They found a way, using DNA profiling, of identifying organisms in 4 hours rather than 4 days. And that was a wonderful thing because it saved lives. But you see, they generated enormous amounts of data in order to do what they were doing. And they could not have existed and proved that their technology saved lives without the help of the analysts and artificial intelligence. So it's the interactivity of people and these different wonderful technologies that are emerging, and I'll talk a little bit about them just in a moment, that to me is the key issue. How do we make that happen? Maybe we have to think about whether we introduce into the educational systems relational thinking as a way of achieving something. And we don't do much of that in schools today. It's all about numbers, isn't it? And achieving targets and so on. So if we look ahead a little bit further to what we've already heard, but taking my example of human behavior, my friend in Cambridge, Professor Chris Lowe, who's the emeritus professor of biotechnology, it tells us we should think of ourselves in different ways, in different groups. So we have healthy people, we have people who are worried, but they're not unhealthy, they're just worried well. We have sick people, chronic people. We've heard about the amazing amount of money spent on the chronically sick. And Chris says that for healthy people, we need more preventative medicine. We need to think more about prevention. For the worried well, we need to alleviate their worries. They don't need the same kind of pills that other people that are sick need. For sick people, we have to be curative and we have to be regenerative. And for the very chronically ill, we have to be augmentative. And we need to think of healthcare. It's a different way of expressing what Martin is saying, really, but it's a different way of thinking about it. And there was a very interesting report published by, I think it was Deloitte that published it. And they spoke about the 3 Ps of future health and wellness: predictive, preventative, and personalized. And those are 3 very powerful words that, in a way, I think perhaps support what you've already heard from the other speakers, because they're saying different things, but prediction, prevention, and then personalization, precision medicine, which is what I know about myself and what my doctors know about me. So we live in this age where there is an immensity of data generation. So digital healthcare, the technology that brings us, thanks to Tim Berners-Lee and others, the wonderful opportunity to connect with each other, then really I think does mean we should be very, very strongly obliged to use it appropriately. The way we use it is going to be very important. So for telehealth, for example, and mobile telephony, mHealth, we talk about mHealth, the way in which the clinician can relate to the client. I don't like the word patient. I'm not a patient. I'm a client for my clinician and a partner. And the way the clinicians communicate with each other and the way information can be conveyed is very, very important. And that to me is a very, very important part of digital healthcare. And, you know, genetics and genomics and proteomics and epigenetics and precision medicine is moving at such a pace. It's an amazing, amazing pace, as Martin has already indicated. I was for 3 years privileged to be the chairman here in Cambridge of the Cambridge Rare Diseases Network. You know, there are 7,000 rare diseases in the world, at least. There probably are more. And there aren't many of the patients or clients with each of them because they're rare. So the pharmaceutical industry doesn't give a damn for those patients, doesn't develop anything to help them. The answer to rare diseases will lie in the proper application of genetics and genomics, because if we can get to some of those 7,000 diseases before they really take root in the patients, we can do something about it. And Chris, my dear friend Chris Lowe, has written a very nice paper, which is all really about virtual health guidance. And he has written about a multi-model data system whereby we might use AI much more intelligently, artificial intelligence. And he's seeking to enable us, through the use of genetics and genomics in particular, to look much more closely at social, behavioral, economic, genomic, microbiome information, and individual microbiome information, and environmental data too, and family history, and also about the state of mind, which has genetic complications and indications. So in this huge world of massive data, we also have an obligation to make sure that we use it selectively and we find out which bits of it are important. And there are other issues, aren't there? There are ethical issues. Whose data is it? How should it be used? It's a very, very big area. And I was hoping we would be joined today, and I don't think he is joining us, from Chicago or Colorado, from a friend of mine who's working on ethical artificial intelligence. So my last 3 points, big points, are ethics and the ethical issues that we have to consider, the issues of the mind, not just the body. The neuroscientists are starting, by the way. Martin talked about the importance of entrepreneurship, and that's been a big part of my life, actually. And the neuroscientists are now starting to look at entrepreneurs and wondering what they can tell us about neurogenetics and how that is influencing the way entrepreneurs work. So ethics is a big thing. Issues of the mind is a big thing. And I want to come back for my final point to something, I think it was Martin, or was it Fabio, said that, half the world does not have access to decent healthcare at a decent cost. And, it's also true to say that half the world has no access to the internet. And without better communication and proper provision of information to people, then that's a really, really big problem. And I'm working with a wonderful entrepreneur who's developed a wonderful, simple little technology that enables people in those parts of the world that don't have access to the internet to get it at a low cost. And that is a very, very big issue too. A very big issue indeed, bigger just than health itself. So that's my input, Gareth.
Thanks very much. And it's 3.5 billion people who don't have access to care, Alan. Huge number, as you say. And I think what I wanted to move on to now is just to give people an insight into how we move this dial forward and make, shall we say, the patient, the client engagement, and who's actually doing that on the ground. And I'm delighted to bring in Dr. Brewster from Maryland to give us an insight into what we have planned in terms of working with, let me get this right, Nacho, is that correct? Public health. And please, Dr. Brewster, just from a transformative perspective on One Health and making that next step to, that entrepreneurism within the system, please share our plans with, the CDC Foundation and what we intend to do as a group collectively and starting in Maryland.
Yeah, sure. Thank you, Gareth. Thank you so much. And what a complete honor to be here with all these esteemed colleagues of ours who have put together this incredible pledge to the world. I'll say the One Health concept and all the concepts within that that were already highlighted, I think are pretty tremendous and incredibly influential to our actual work on the ground, as you referenced, Gareth. If I may, before I go into talking a little bit about what we're hoping to do and gathering the public health partners here on the U.S. side, at least, I just want to tune in. I just found it so powerful, these phrases that each of the speakers have already talked about. Piero, you started by mentioning that the end point is holistic health. And that's just such a true concept. And I think it's one that we've been working towards for decades, but we really, our progress has been slow. And so I'm glad to hear that this momentum is building worldwide. And I'd love to talk a little bit more about that and how we're applying that concept at a local level. Martin, you talked about from hospital to home. And I love that phrase and that transition. That concept is wonderful. And I would add, it's as you talked about, as you described home, it's really, in our perspective in public health, it's from hospital to home plus community, because so much of what is happening that's affecting people within their homes is actually within their context of their own local communities. And Fabio, you mentioned systems thinking. And you talked quite a bit about systems thinking and the importance of that and the systems development there and how a stress on a system can actually change the quality of that system. And I think that's incredibly important as we are developing these constructs globally. We have to keep our eye, these systems thinking type constructs globally. We have to think about implementation of those systems and how that implementation is happening in communities and neighborhoods, individual communities and neighborhoods and families throughout our respective countries. Alan, your comments really resonated with me as a practitioner and then also as somebody who's on the front lines of public health and preventive health and community health. You specifically use the phrases relational development, and I love this, connectricity. I think there's so much of that happening at the local level when we're implementing all these concepts that have been discussed. So again, as I said, while we're developing all of these concepts globally, And I'm so excited to see the countries coming together behind this One Health concept and behind the UN Sustainable Development Goals and the work of the WHIS. Our implementation at local levels is so critical to engaging and building trust with the population that we're serving. It's that relational development that Alan was referencing. It's also really the local level is really the fertile breeding ground for the innovation. I think that we need to see develop. People see the direct impact of the gaps in systems. People see the direct impact of the advancements in systems, and it gives them the thought and combined with their own creativity and those relationships. I think all of that comes together to generate the innovation that we need to keep moving us forward in our One Health concept. I'm a public health officer. I'm a primary care physician. I'm a family doctor, and I lead a local health department in Southern Maryland, which is a state on the eastern coast of the U.S. And I've been a health officer for this county for a little over 10 years, and really have seen so much to give us hope, and so much that gives us hope, I think, is seeing the community partners in our county and across the country really come together and really recognize that we do need to shift that model from that very expensive tertiary care medicine to the much more holistic preventive concept and focus on human behaviors that impact health. One of the other areas that we've really started to recognize more, I think in the past couple of decades, at least here on US side, is the incredible impact of these non-medical factors in our community, which, as many of you know, we tend to call social determinants of health. And that's really what that social prescribing piece gets at. The social prescribing is really trying to connect the clients, or patients as we may have previously called them, to resources that can help enhance their social determinants of health and really lead to that endpoint of holistic health. So one effort that we're doing here locally in our community is we're working with many a variety of community partners to implement access points to healthcare services, specifically for mental health and drug use recovery, and also primary care. And yet we're doing it in a way where we're folding in all of these other community services that address a variety of social determinants of health. So from youth mentoring to academic tutoring to employment supports to financial coaching and conflict mediation and legal services, all of these things that really have an impact on somebody's longer term holistic health, yet often don't get the attention they need when we approach things from a traditional siloed medical kind of way. So I'm really proud of the effort that we have in development here in St. Mary's County in Maryland, and I'm happy to explore that in the future with any of these colleagues. And I'm so inspired, again, by everything that was already discussed. What Gareth is talking about is, of course, bringing in and folding in a lot of our systems partners. And in public health here on the US side, we've got some amazing national associations and organizations that are representing public health at the national level. And that specifically with the National Association of City and County Health Officials are representing local public health at the national level. And then, of course, organizations like the CDC foundations and others who are very much interested in participating and creating this more successful One Health initiative. So I'm really excited. We're hopefully looking at building those partnerships, and as those partnerships build, generating some support for these local level grassroots efforts that are actually implementing that One Health concept every day.
Thanks a million, Meena. Let me just go around the table to everyone and get some final thoughts, and then we'll go to Piero to wrap up. Martin, could we go back to you and just give us your thoughts in terms of next steps on health?
Oh, thank you. Apologies, Gareth, for the...
Oh, I think we've just lost Martin. I think he'll come back in. Let's go to Alan.
Okay, I mean, I would only remind us that in this age, when we have so much data flying around, going back to the issue of putting people first and making the relationship issues the ones that are important. I mean, I got some facts that I didn't give you earlier when I spoke. Medical data doubles in quantity every 73 days. That patient monitoring with all the wearables, we're all walking around with equipment strapped to us that tells the doctor, if he could get the information from us, everything about our bodies. Now, it's all happening very amazingly. Chris Rouleau told me that about 1,000 readings per second are being made and 86,400 readings a day. And I think that we don't want to get overpowered with the technology. I want to keep bringing us back to what can we do with it and how can we manage it in order that it focuses on the one health issue. And the wellness issue is as important as the sickness issue. And I've heard so much today that reinforces my thoughts about that I feel very privileged to have been part of this discussion.
Fantastic, Alan. I think we have Martin back.
No, absolutely, and sorry for that tech difficulty. I think, you know, the book actually is a platform for achieving, you know, one health. It's actually the synthesis of some really strong ideas, and I mentioned earlier the idea of shared vocabulary, and I think that's going to be crucially important. And what I would like to do is to take, you know, One Health and to invite, you know, Professor Formica Piero to present at the upcoming United Nations Digital Health Symposium. We've just launched actually this week the Manhattan Manifesto, and Stay Left, Shift Left, 10x. Stay Left is the idea about keeping well people well, or if you have a chronic condition or need rehab, that you can be treated best of all from home. Shift Left's about moving patients, as Meena said, as quickly as possible from an acute into a community and then into a home setting. And then 10x is the notion that every time we deploy digital technologies in a health setting, and that actually can be a human health setting, or it can be an animal health setting, or an environment health setting, we get 10x returns. And actually some of my own first engagements in One Health were around, for example, monitoring air quality in the city of London and Dublin and San Jose, and learnings we can get. Andy Grove used to say, if you can't measure it, you can't manage it. Pierre's identified a number of different triggers or energies, these disruptive technologies, but the Internet of Things is going to be very crucial. For example, in London, you know, we were reporting real-time air quality around the borough of Enfield, and that can lead to, you know, real-time changes in congestion charging or incentives for using park and ride. So the Internet of Things is going to be critically important. In Ireland, for example, we actually have a much more sophisticated Internet of Things solution for our pigs. It's called PigLink, and our animals are better instrumented and better cared for than humans. So one of the opportunities, a couple of weeks ago, I was presenting in San Jose, and I met with Tom Bianculi of Zebra Technologies, and the introduction of RFID technology, particularly to patients and doctors and nurses, could be really important in terms of moving towards One Health. So the next step for me is to invite Piero to New York in September to present the book and some of the key concepts, and then to work with you, Gareth, in the WHIS to see how we can join some dots and gain momentum here. But thank you.
Absolutely, Martin. I'm very excited for that opportunity. And let me hand over to Fabio.
Yes, let's say that the next step from my side is to review the innovation mechanism in order to implement this vision. And just to make an example, I got just yesterday the approval of a European project where I proposed to use open hardware and open software in the water, energy, and food nexus in Africa to try to rebuild connections, let's say, which are virtuous and they take care of the One Health approach without creating technological dependencies from the north. So the global south should build its own way, and its own way is also about ownership of solutions by communities. So this is the way we have to start rethinking the components of innovation. We have to break dependencies, help the reconnection of the different domains, and empower people to understand and take care of the different dimensions. And I think that's the way, and we will help each other.
Thanks a million, Fabio. Just finally, Piero, your final thoughts.
Thank you. A few words. Most have been said by all of you, and Martin was presented some of our recent books. Back to the future, says One Health. Back to the future means that One Health calls for what they call the polymath, a word invented in the 1700s. The polymaths, they lack transdisciplinarity. They don't want silos. We need to move from silos to transdisciplinarity. People who study at the same time medicine and ancient Greek, like Madame du Châtelet. The One Health looks at, say, the conversation, as has been said by Alan, which means the intellectual saloon again of the 1800. People from different disciplines, but common denominator to be polymath, they inquired, they raised the cognitive conflicts, and they resolved so many problems of that age. So polymath, no silos, more quality, less quantity, more conversation connectivity. And let me add that at the end, wishing everybody, One Health says to everybody, cum motus animi continuus. Cum motus animi continuus. This is my final words, and thank you very much for this day. You made my day, saying this way, and good luck to everybody.
Thanks a million, Piero. And I just want to finally say thanks to all our guests and thanks for tuning in. We've been delighted to host this event, and we very much look forward to working with everyone in the future. So we'll end this broadcast, and we'll publish all the links in terms of where you can pick up the book. And I'm very much excited about the future and looking forward to delivering One Health. And that's our aim and objective. So from all of us, thanks for joining us, and we'll close.